Diabetes is a chronic medical condition in which the body either does not produce enough insulin or cannot effectively use the insulin it produces. Insulin is a hormone produced by the pancreas that plays a key role in regulating blood sugar glucose levels. Without proper insulin function, blood sugar can become dangerously high, leading to a range of health complications. Types of diabetes. Type 1 diabetes. This form of diabetes is typically diagnosed in children, teenagers, or young adults. It occurs when the immune system mistakenly attacks and destroys the insulin-producing beta cells in the pancreas. People with type 1 diabetes require daily insulin injections or the use of an insulin pump to manage their blood sugar levels. Type 2 diabetes, representing the majority of diabetes cases. Type 2 diabetes usually develops in adulthood, though it is increasingly seen in younger individuals. In type 2 diabetes, the body becomes resistant to insulin or doesn't produce enough insulin to maintain normal glucose levels. Management may include lifestyle changes, oral medications, and sometimes insulin therapy. Gestational diabetes. This type occurs during pregnancy when hormonal changes can lead to insulin resistance. Although gestational diabetes often resolves after childbirth, it increases the risk of developing type 2 diabetes later in life for both the mother and the child. Other specific types. Other forms of diabetes can result from genetic conditions, diseases of the pancreas, certain medications, or other health issues. These are less common and are generally classified under other specific types of diabetes. Causes and risk factors. Genetics. A family history of diabetes can increase the risk. Lifestyle, diet, physical inactivity, and obesity are significant contributors, especially in type 2 diabetes. Autoimmune response. In type 1 diabetes, the immune system's attack on pancreatic cells is the primary cause. Hormonal changes. For gestational diabetes, pregnancy-induced hormonal changes are a trigger. Other medical conditions. Conditions such as polycystic ovary syndrome (PCOS) can also raise the risk of developing diabetes. Symptoms. Common symptoms of diabetes include increased thirst and frequent urination, unexplained weight loss, fatigue, blurred vision, slow healing of cuts and wounds, frequent infections. It's important to note that some people, particularly those with type 2 diabetes, may experience mild or no symptoms in the early stages of the disease. Complications. If not managed properly, diabetes can lead to several serious health issues, including cardiovascular disease, increased risk of heart attacks, stroke, and other heart-related complications. Nerve damage. Neuropathy. Excess sugar can injure the walls of the tiny blood vessels that nourish your nerves, especially in your legs. Kidney damage. Nephropathy. Diabetes can damage the filtering system of the kidneys, potentially leading to kidney failure. Eye damage. Diabetic retinopathy can lead to blindness if not treated. Foot damage. Poor blood flow and nerve damage increase the risk of foot complications, which can sometimes lead to amputation. Skin conditions. Diabetes can make you more susceptible to skin problems, including bacterial and fungal infections. Mental health. Managing a chronic condition like diabetes can sometimes contribute to depression or anxiety. Management and treatment. Managing diabetes involves a comprehensive approach. Blood sugar monitoring. Regular monitoring of blood glucose levels is essential for adjusting treatment plans and managing day-to-day changes. Medications. Insulin, essential for people with type 1 diabetes and sometimes required for type 2 diabetes. Oral medications. Various medications help to improve insulin sensitivity or reduce glucose production in the liver for those with type 2 diabetes. Diet and nutrition. A balanced diet that emphasizes whole foods, vegetables, lean proteins, and whole grains can help regulate blood sugar levels. Carbohydrate counting is also an important tool for many people with diabetes. Physical activity. Regular exercise helps improve insulin sensitivity and can contribute to weight management and overall health. Lifestyle changes. Weight management, quitting smoking, and reducing stress are important components of managing diabetes effectively. Regular checkups, regular visits to healthcare providers to monitor blood sugar, blood pressure, cholesterol levels, and screening for complications are critical. Prevention: while type 1 diabetes is largely beyond control, type 2 diabetes and gestational diabetes can often be prevented or delayed with lifestyle modifications. Maintaining a healthy diet, engaging in regular physical activity, and managing weight are key preventive measures. Research and future directions. Ongoing research in diabetes includes exploring better methods for early diagnosis, improved medication delivery systems, and even potential cures like beta cell transplantation and immunotherapy. Advances in technology, such as continuous glucose monitoring and artificial pancreas systems, have significantly improved the quality of life for many people with diabetes. In conclusion, diabetes is a complex and multifaceted disease requiring ongoing management and care. By understanding its types, causes, symptoms, complications, and treatments, individuals and healthcare providers can work together to manage the condition effectively and improve long-term health outcomes.